I just like being here. I like the way it flows.
I just say the CMHC is a place that you can get help and have fun doing it.
This center really, really caters to the people that need the help the most.
I think it's important for people to get treatment in their communities because treatment is so much more than what I do for a person individually. In 1963, President Kennedy signed into law the Community Mental Health Act, which was to encourage treatment to move from these very large state institutions into the community. And in 1966, the Connecticut Mental Health Center opened its doors. The two great names that have been repeated are Fritz Redlich, who was the chair of the Department of Psychiatry at that point, and Abraham Ribicoff, who was the governor, getting together and discussing how they would design a community mental health center that would serve the needs of New Haven.
I came in homeless, without education.
I was drinking and doing all them things I shouldn't have been doing.
I came here from Bedford Hill Correctional.
This place saved my life. I would just be home existing. I wasn't even living.
Why should you put a mental person in jail when they need treatment?
In tragic times, to help you cope, to help you discover what strengths you may have inside you.
When I feel like I'm not myself or my thoughts are too overwhelming, I need someone to talk to.
The novelty of the Connecticut Mental Health Center is the collaboration between Yale University and the state.
It's been important for us, and knowing that Yale is leading the work there, that clients in New Haven can receive services there. It's state of the art. The research piece, I think, that Yale brings to the table is so important in terms of being able to implement evidence-based practices.
One of the things that we do here is teach the next generation of psychiatrists and psychologists and social workers about public psychiatry in situ, in a situation where they're actually doing the work.
We provide mental health and addiction and prevention services to individuals throughout Connecticut who are uninsured or underinsured.
I think that the new way of looking at mental health and addressing some of it, of putting the patient in the driver's seat, CMHC is a little bit ahead of a lot of other people.
I got involved with the Director's Consumer Advisory Council.
I view them as my board, and I have to present to them about how things are going at CMHC.
I think it shows that they care. They want us to feel good about coming here, and a lot of us do.
Citizenship is a principle that we're looking at quite a bit. And that includes sort of looking at how people are connected to their communities and have meaningful roles.
Here you get the treatment, you get the opportunity to engage back in society.
There's a lot more to CMHC than just seeing your therapist.
I like participating in the things here at mental health. It's given me something to do instead of being home depressed.
And CMHC is that kind of place where you can get that kind of support because everything is not on a pill.
I like to think of myself as I'm independent, but I also rely on help.
The Hispanic Clinic, they give you the tools, herramientas, and then you can work with yourself.
This place gave me the opportunity to start looking at myself and be accountable for what I say and do.
I have my bachelor's in biology, and I work full-time as a nurse's assistant, and I'm currently in the process of going into nursing school to become an RN.
I have a part-time volunteer job. If you asked me this 10 years or 5 years ago, I'd laugh in your face. I've accomplished what I accomplished.
I'm going to Recovery University right now to be a peer specialist, support specialist. That's my big goal right now. The small goal, I'm living it right now. You see what I'm saying?
You can get better. So when I was offered an opportunity to work part-time at the bistro, which is right here on the second floor in the cafeteria, I jumped at the opportunity. You make friends with everybody when you're satisfying their stomach.
So certainly at this anniversary time, one of the things I really want to acknowledge are the staff and the clients who are the heart of CMHC.
I think the staff at CMHC are world beaters. I think there's no question about their dedication and creativity in the face of very constrained resources.
The people that work in CMHC kind of work as a family, so it's like a second family.
One resident in particular was very outstanding.
I got this incredible therapist who turned my whole life around.
They're learning about the whole person, not just an illness.
I would say it's therapeutic. The idea that you come here and you're treated as a person, you're treated as someone who matters, that helps everybody.
I would not be sitting here talking to you if I didn't have CMHC in my life.
When I come here, it's like I have friends here.
You know, they don't give up, so why would you?